I think one of the biggest misconceptions is they don't realize the services that are provided here. These are patients to us, they're not just inmates, and there's a real opportunity here to provide them with services that they wouldn't have access to in the community, and those are the services that are often neglected and they're not compliant with. So for some of these patients, it's the first time that they've really had mental health care, they've had access to medications, they've had access to therapy, and to seeing doctors that they normally wouldn't see in the community. So in addition to being incarcerated while they're waiting to pursue their legal issues, we're working every single day addressing all these medical and mental health issues and a progressive plan, a care plan to help them move forward and take control of their own health care.
I think that probably one of the biggest misconceptions in the community about mental health in the corrections facility is that it is somehow the will of the patient to act out, that it's an intentional behavior. And oftentimes, or in most cases, that's not the case. The patient is acting in a way that they lack control over, and we need to help them to behave differently in a way that's more socially appropriate. But I think one of the big challenges is that folks see that as something that a patient has the ability to control themselves.
I think the biggest misconception is that the Mecklenburg County Sheriff's Office, Correct Care Solutions, is not focused on providing quality care to the patients that come to this facility. It is our passion to provide quality care, to keep patients safe, and quite frankly, improve their health care status to a point where they're better off when they leave than when they came. Are we perfect? No. But our focus is on to identify people early on and to improve their health status and not to deny. The biggest misconception is that the staff at any facility are looking to deny care when really we're looking to promote health care.
Being the sheriff, looking at, we got to make sure that I have a very, very strong health care partner. Did not realize until I became the sheriff that actually our facility is the largest mental health holding facility in the county. And we want to make sure that these folks are cared for when they're in our facility and in our custody.
I invite anybody who's skeptical about it to really dig in and learn a few stories about a few people who have behavioral health disorders who are in the jail and the justice system. Because usually if it is, if you really look into it, it's not as simple as this is a bad person and they did something and they need to be held accountable. There's usually much more to it, and often there's a lot of misfortune there, and if people were well, then those situations wouldn't occur.